Hi friends, welcome back to Lormedics. This lecture is on humerus bone. Humerus bone is the long bone of upper arm and it extends from the shoulder to the elbow. It is rounded at upper end and triangular at lower end. It has three borders and three surfaces. This is anterior border, medial border and lateral border, and surfaces are anteromedial surface, anterolateral surface and posterior surface. It has three parts: upper end, shaft and lower end. First, upper end, it has head, greater tubercle, lesser tubercle and bicipital groove. Head is rounded and covered with articular cartilage, and it is articulated with glenoid cavity of scapula, and it forms the shoulder joint. The line which separates the head from the rest of upper end is called anatomical neck. It is also called as collum anatomicum. The elevation on the anterior aspect of upper end is called lesser tubercle. The subscapularis muscle inside in the lesser tubercle. Long elevation behind the lesser tubercle is called greater tubercle. It has three impressions. They are upper facet, middle facet and lower facet. Bicipital groove. The area between greater tubercle and lesser tubercle is called bicipital groove. It is also called as intertubular groove. It has medial lip. The lesser tubercle extend and form the middle lip, and the greater tubercle extend and form the lateral lip. The narrow line which separates upper end from the shaft is called surgical neck. Now the shaft which connect the upper end and lower end. The radial groove is passed on the posterior surface of humerus. The radial nerve and profunda brachii artery are passes in the radial groove. The shaft has deltoid tuberosity, medial supracondylar ridge and lateral supracondylar ridge. Lower end has articular parts and non-articular parts. Articular parts are capitulum and trochlea. Non-articulating parts are medial epicondyle, lateral epicondyle, radial fossa, coronoid fossa and molecularon fossa. First, capitulum. Capitulum means cap shape, cap-like structure. It is a rounded projection on the lateral side and it articulates with head of radius. Trochlea. Trochlea is the pulley-shaped surface. It articulates with trochlear notch of ulna. Medial epicondyle. It is a bony projection seen on the medial side of lower end and it can be felt below the skin at elbow. Ulnar nerve passes on the posterior aspect of medial epicondyle, and the medial epicondyle gives the origin to all superficial flexor muscle of forearm. So it is also called as common flexor origin. Bony projection on the lateral side of lower end of humerus is called lateral epicondyle. It is smaller than the medial epicondyle and it gives the origin to all superficial extensor muscle of forearm. So it is called as common extensor origin. Coronoid fossa seen on the anterior aspect of ulna and just above the trochlea, and it accommodates the coronoid process of ulna when we flex the elbow. Radial fossa. It is a depression seen on the anterior aspect and above the capitulum. It accommodates the head of radius when the elbow is flexed. Molecularon fossa. It is a depression seen on the posterior aspect of humerus and just above the trochlea. It accommodates the molecularon process of ulna when we extend the elbow. Now we see the muscle attachment of humerus bone. Origins are slightly difficult, so first we see the insertions. Mostly upper end has insertions and lower end has origin. Greater tubercle, it has highest impression, that is superficial facet. The supraspinatus muscle insert in the superficial facet and infraspinatus muscle insert in the middle facet and teres minor muscle insert in the lower facet and subscapularis muscle insert in the lesser tubercle. These four muscles altogether called rotator cuff muscle. Latissimus dorsi muscle insert in the bicipital groove. Teres major muscle insert in the middle lip. Pectoralis major muscle insert in the lateral lip. Coracobrachialis insert in the middle of medial border and deltoid muscle insert in the deltoid tuberosity. Now the origin. Brachialis muscle in lower one-third of anteromedial and anterolateral surface. Posteriorly, lateral head of triceps brachii arises from above the radial groove and medial head of triceps brachii arises from below the radial groove. In lower end, brachioradialis muscle arises from upper two-third of lateral supracondylar ridge. Extensor carpi radialis longus muscle arises from lower one-third of lateral supracondylar ridge. And humeral head of pronator longaris muscle arises from lower one-third of medial supracondylar ridge. And anterior aspect of medial epicondyle give the origin to all superficial flexor muscle of forearm. So it is called as common flexor origin. And lateral epicondyle, it gives the origin to all extensor muscle of forearm and also the supinator muscle. So it is called as common extensor origin. Anconis muscle, it arises from Posterior surface of lateral epicondyle. Humerus has two joints. One is shoulder joint, another one is elbow joint. Basically, the joints are covered with ligaments, right? So the capsular ligament of shoulder joint, which cover the full anatomical neck of humerus, and in capsular ligament of elbow, which extends from upper end of glenoid fossa and radial fossa anteriorly and olecranon fossa posteriorly. How to determine the sides of humerus? Upper end should be rounded and lower end should be extended from side to side, and the head directed medial and towards the body, and posteriorly the olecranon fossa is present. So we can determine the side. Now the blood supply of humerus. Proximal end supplied by anastomosis of anterior and posterior circumflex artery, which arises from axillary artery, and the blood supply to the lower end nutrient artery and segmental artery. Applied aspect of humerus bone. Fracture of surgical neck of humerus, shaft of humerus, and supracondylar ridge fracture. These fractures affect the respective nerves and blood vessel near to the fracture, and axillary artery, which is near to the surgical neck, radial nerve, which passes in the radial groove, and ulnar nerve, which is present posterior to the medial epicondyle. Question time. Common flexor origin of forearm is medial epicondyle. Common extensor origin of forearm is lateral epicondyle. Thanks for watching.